Hello, how is everybody today? I'm Dr. Jody Edashore, and welcome back to BioNexus Health podcast series, Autism Uprooted. Today, we are lucky to have with us Pooja and Vikram, an Indian American family from the Seattle area. And Pooja is going to discuss the amazing journey that she's had with her son Akash, little Akash. He's done remarkably well on a completely plant-based herbal protocol to the point where it's impossible to diagnose him as being on the spectrum. Akash was diagnosed as being on the autism spectrum, had numerous gut issues, as well as failure to thrive, barely any language. And today it's a complete almost a complete 180 according to Pooja, but I will let her and her very supportive husband, Vikram, tell us a little more about their journey.
Welcome to the BioNexus Health Podcast with Dr. Jody A. Darshaw, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jody A. Darshaw.
So without further ado, I would like to welcome Pooja and Vikram to today's podcast. Thank you so much for joining us today.
Thank you, Doctor.
Yeah, pleased to be here.
Yeah.
Good. All right, so let's start. How is little Akash doing? He's doing well today?
He's doing wonderful, Doctor. He's
Good.
doing very well. Yeah.
Good. So
after consulting with you, he's doing really, really well.
Good. So let's backtrack a little bit, Pooja. Can you tell me, when did you realize that Akash wasn't developing normally? When was he diagnosed with autism spectrum disorder or being on the spectrum? And what symptoms did you see back then?
When he was like 4 years old, he had difficulty like talking, and he was not able to communicate very clearly. He had all the words, but like making up a meaningful sentence was challenging for him to do. And he also had like digestive issues, like a lot of bloating. And like this actually started when he was like 2 years old. And from morning until he sleeps, he would have this very terrible bloating every single day for like, from when he was like 2 years. It was very bad. And he also had trouble sleeping through the night.
Okay. Did you have any kind of temper tantrums, any kind of behavioral problems?
No, he did not have any behavioral issues. It was mostly communication issues,
Okay.
like, talking and understanding was his biggest challenge.
Okay, comprehension was an issue.
Comprehension, yes, comprehension was an issue as well. Yeah, comprehending and yeah.
Okay. What about eye contact, socialization, understanding that you are mom and dad?
Yeah, he understood that we are his parents, but still socialization, it was challenging because he was not able to communicate. Even though he wanted to socialize, he did not know like what to say and how to talk to people to make friends. Yeah.
How was
that was really
sorry? Okay.
Yeah, that was really hard for him.
How was his diet? Was it very limited? Was he a picky eater? Like, I'm asking, was it limited because you mentioned lots of gut issues for him?
Yes. No, his diet, actually we consulted actually one of the top dietitians in the country, and he was doing like a lot of like fermented food, and we were off dairy for a very long time, and we were off gluten too for a long time, but still we did not see any improvements in terms of his gut or in terms of his communication. We We also consulted many of we also did many popular protocols on our own. We researched and did most of the protocols out there to help with communication and everything, also improving his gut. Yeah, but nothing worked actually.
Okay.
His symptoms became actually worse.
Oh, I see. Okay.
Yeah. Yes, it did not help him. And yes, and we even did like the paleo diet, and it made his some symptoms very worse, like his gut issues. His bloating was he was yeah, he used to cry because he felt very uncomfortable.
Oh, okay. Poor kid.
Yeah.
So, how did you hear about BioNexus Health, and what made you decide that you wanted to take this route of plant-based medicine treatment options? First of all, what made you think that autism could be treated per se? Did you ever think you could reverse it, or were you looking to just, help him with his symptoms?
um, I always had a very strong intuition that he will definitely recover. And I would always look at the success stories instead of just going and seeing what is not working. I always chose to see what is working, what we can do to help him come out of this completely. And my strong intuition led me to Dr. Deshore. And I had a very strong feeling even before I met her. I knew for sure she is going to recover our son completely. And it is true, it happened.
Oh,
He
wow.
recovered completely.
Cool.
Yes, in every single way, in every aspect, socially, emotionally, communication, everything improved.
So let's get right into that then, right? So,
Yeah.
where how did his recovery start? Like, what recovered first? First of all, it was a very comprehensive protocol, right? We did a lot of lab testing to look at
Yes.
underlying causes, and I explained to you that sometimes, autism can be a false positive, and sometimes autism can be a symptom of something else
Yeah.
that is going on underlying. So,
Yeah.
what do you remember what we found after the lab testing? Do you recall?
During our first consultation,
Mm-hmm.
you saw him and you said, like, you spoke to him, and then you observed him, and then you said like he was misdiagnosed. And you also told us that most of his symptoms are due to Lyme disease. And at that point of time, we did not know anything about Lyme disease or anything. And you explained us very clearly what it is, and you walked us through what we will be doing and how we are going to further proceed with his treatment. And you also did like a couple of tests to make sure that we are heading in the right direction. And then you confirmed that, yeah, he had Lyme disease. The results confirmed that. And then you started your herbal protocol with him. And then the magic started to happen.
Okay.
In just 2 weeks, his digestion improved dramatically, and he was feeling very comfortable, and his bloating disappeared completely. And this was a huge thing for us, and he felt very comfortable. And he also started to communicate very well. And the biggest thing is he slept through the night every single day. That that is truly magical. And yeah, we are very grateful to you, Dr. Deshore, for that. It really helped us as a family. Him sleeping through the night, it was a big deal for us by at that point of time. And every single day he got better and better and better. And yeah, and he also excelled in school in all areas, socially, academically, emotionally, and in every single aspect. And this is like a big achievement, and a great thing for us, for as a family.
He has started speaking in sentences now. He is excelling in school, right? He is age
Yeah,
appropriate. He is,
yeah,
yeah, he is in a typical mainstreamed classroom now.
yes. And he speaks everything in, sentences, big sentences. Yeah, whatever. He can give speeches, he, yeah, he's like any other child.
Okay. Doesn't it make you wonder, Pooja, on what basis was he diagnosed
Uh,
as on the spectrum? On what basis? I mean, it's very interesting to me when I hear
yeah,
stories like that. Mm.
yeah, actually, even we were not sure. Like one of our friends, she was a therapist, and so she has experience dealing with kids.
Mhm.
And then when she saw our son, she thought maybe he's in the spectrum. So even we did not know anything about it. And we went ahead with the doctor, and the doctor was not sure for the first time when he
Okay.
diagnosed. And then with our friends' advice, we just went ahead and we thought, okay, maybe we need more help with the therapy.
Right.
So the doctor thought, okay, maybe if the therapy could help, that's good. And then he gave the diagnosis. But then even the therapy, it did not help him, right? He did not feel better even after the therapy. The bloating was still there. The
Mm.
communication issue was still there.
Mm. And what kind of therapies did he go for? Speech and OT? What kind of therapies?
Speech and OT, yeah.
Yeah, speech and OT did that. Okay. Now,
Yeah,
the herbal protocol, BioNexus protocol, has a lot of components to it. You have to go step
yeah,
by step. There's capsules and liquids and drops and um, homeopathic medicines. Then there is herbal medicines. So how did you
yeah.
manage? There's also a pretty strict diet which has to be followed. How did you manage? How did Akash manage? The little one.
Yeah.
Was he cooperative? I mean, I think what you have achieved with him, both you and Vikram, Pooja, what both of you have achieved with your son is amazing. So can you tell me how you manage that?
Yeah, actually, as I told you, I had a very strong intuition before even I met you. I don't know if you remember, I told you this, right? During our first consultation,
Yes.
I had a very strong feeling that you would be the doctor who would completely recover him. And somehow I think that energy is there in our son too. He picked it up. He was very receptive to all the treatments, and whenever I gave him all the herbs, you remember, doctor, he used to just have it, right, without any fuss or anything. He just used to, and he even swallowed tablets, right? At that time, even you were amazed when I told you he can just swallow tablets at 4 years old,
At
right?
4 years old. Yeah.
Yeah. And he was very receptive, and even he felt so positive. And yeah, and he really loves you so much, right? Every appointment he comes and he talks to you, and he knows, I somehow feel, even intuitively, he believed that your treatment is going to work for him, right? And I think that positivity really helps a lot. Yeah, being very positive really helps with the treatment overall.
Yes. One incident that really stands out in my mind is when you put Akash in summer camp, and I think it was an acting camp or something, and
Yeah,
right, and he became
yeah,
his teacher's favorite, and no
yeah.
one had a clue that there was anything wrong with him at all, or there ever had been anything wrong, right? Something like that.
Yeah. Yes, yes. No one knows. Like now, no one knows. No one can even find out that, we had gone through even something like this. Yeah. No, yeah. No one will even believe us if I go and tell them, because he is doing so well. He communicates so well. And especially, he's very good in giving speeches. Even on the spot, you give him a topic, he can just do really very well.
Oh,
He's
excellent.
very, yeah, he likes to talk and give speeches. and it just comes naturally to him now. And since he has like now the entire language built, it's so easy for him to just communicate and socialize with almost anyone. Yeah.
Yes, we found concerns with mycotoxins. We found concerns with some other toxins, with Lyme disease, additional infections, and what have you. And, all of this is what we addressed, and what seemed to be this curtain of autism-like symptoms just lifted for him.
Yeah.
Yeah.
It's magical. That's what I would say. It's unbelievable, but it's true.
Now,
recovery is possible.
Of course. Now, let me ask Vikram. Vikram, what was your response? Like, you've been quiet there, so I wanted to, pull you into the conversation. What was your response when Pooja told you that she wanted to try something that was completely herbal, and that she doesn't believe it's really autism, there must be something else going on with Akash? Like, did you feel like supporting? Were you skeptical? Can you tell me from a father's perspective?
At first, I was skeptical because I had very poor knowledge in terms of non-standard medications. So I really didn't have any clue about it. So I started reading. She told me a few things. Then I tried to read through a little bit more. And then I really thought, we should really explore what's there, because there are other forms of treatments that have a different philosophy, and they try to go after the root cause. And that's how I thought, and one of the things she suggested was your protocol, and how thorough it is, and how successful it has been. So she was really hopeful, and so a lot of times I trust her judgment and her intuition. A lot of times that's always, I would say, always it's been in the right direction for us. So I just went along. So that's how I started. But now I'm completely a true believer now. So, and because I've seen the improvements in him, and overall, we not only him as a family, her as well. Everyone has benefited of this whole protocol. So I think, right now, today, if I would not hesitate even a second to recommend any one of our friends to try this. So
yes, it's well, good. Thank you for that. I'm so glad that you discuss this in broad detail, because I'm sure many can relate to that. Now, one thing, Vikram, that you mentioned was something that is very close to my heart, is the health of the mother as well. Because when a child gets the diagnosis, of course, mom and dad are both affected, but moms seem to be so far more affected than dads, because they are so emotionally attached to their child. They're so close to their child, especially with there being no family history, let alone autism. The two of you have no family history of any neurological problem per se, right?
Yeah, yes, that's right.
That's
no neurological problem, no psychiatric problems. In fact, people in both your families are quite brilliant. It's the opposite.
Yeah, that's true.
Yes,
that's really true.
Right? So that
it's definitely a shock to us when we initially had the diagnosis, and it took us some time to even to sink in, and sort of first couple of months was just shock, and then we slowly started seeing what it is, and then just what can be done to reverse it, right? So that's the next step, because initially a lot of people told us it's we didn't want to believe what was said, because we always thought, everything is reversible, body is smart, body can handle things. So we thought, what is there to recover this situation, right? So that's how we started. So yeah, after the first 2-3 months, I think the journey started towards healing.
Towards healing. 2-3 months. Fantastic. Right. Right. And he has, the rest of his life ahead of him. Even if it takes 2-3 years, like for me, it took a few years, because Lyme disease is a slow process, especially when it affects the brain. It affects multiple systems in the body. So it's important not to forget, like for you guys, it was the gut and the brain, which was affected. Now, one other similarity I feel, Pooja, that you and I have is, it
Yes.
was, it is, what I like to say is the blessing of illness, the gift of illness, because I was able to help my son, and because of his journey,
Mhm.
my issues were also healed. My problems were discovered, my problems were addressed, and they healed. So I, as they say, physician, heal thyself. I did, by God's grace. And then for mothers, that's what I exactly say is, mothers, heal thyself. And I think
Yeah.
you took that advice to heart. And
Yeah.
right, so can you tell
Yeah.
us a little bit about that?
Yeah. Yeah. That's very, very true. Whatever you said is very true. I don't know if you remember, like during one of our appointments with our son, you looked at me and you said, you had an intuition, and you told me you need to go check your iron levels, right? And in 2 weeks, I was like not feeling well. I had like fatigue and less energy, and I couldn't even like do any kind of work, And then I went and checked my iron levels. It was low. And I was like, oh, she's a genius. That's what I was thinking. You just knew by just looking at me, you just told this. And then I discussed with you, and then I consulted you, and then uh, I learned that I am affected with Lyme too, right? And then you started me with the herbal protocol as well, and you also ran some tests for me, and then we started working together. And another thing I wanted to tell is my protocol and my son's protocol, they are all very individualized, right? I
Mhm.
mean, yeah, you don't, it's not like everybody has the same protocol. No, no. All your treatments are very individualized, and with your care and support, I recovered beautifully, and I'm having lots of energy. I'm doing all my work. I feel very happy and healthy, and
Wow.
we are very grateful for you, and you know that.
Yes, of course. And I've also explained to you that it's not just me. It's a lot of blessings that I am. See, I don't have any words how to explain that. It's just, I just feel that I'm just a vessel. I'm just a messenger, uh, just trying to help, people and families go back to nature, because plant-based medicine helped my child, helped my family, and I'm very grateful to Mother Nature for all that Mother Nature provides. Such powerful medicines. It's just absolutely fantastic. Now, and you know what, Pooja and Vikram, it has been such a privilege to be able to work with your family. I think all of you, including Vikram, is on BioNexus herbals of some sort or the other, right?
Yes,
Some sort.
that's
Yes,
right. Yeah,
yes, yes.
Yeah.
you are not only, I mean, you are not only a family doctor, you are a spiritual guru, guide, and well-wisher, and you're very understanding, and you not only prescribe protocols, but you also give us like a lot of emotional support in every appointment, and we're very grateful for you every single day, doctor. And our son is completely recovered in every single aspect, and it's all because of your amazing treatment and your kindness. And yeah.
Oh, thank you so very much. That is very kind of you. Very kind of you. I am so blessed to have met you guys, and to see Akash's journey has been just mind-boggling. I remember Brian around age 11, no, around age 12, between 12 and 14, he started giving lectures and speaking at medical conferences where he was invited. So I think, Akash is headed that way as well. He's going to be helping so many people.
Oh, thank you so
Thank you,
much
doctor.
for all your wishes. Yeah, you are our family doctor now, doctor, and we always consider you as one of our family, because that is how you always treated us, with kindness, love, and respect. So you are our family.
Likewise, Pooja. Likewise, all my patients and their families are like my extended family. And as you know, almost everything that is given to you guys has been tried by either my son or myself. We have been on it. Like this whole, my whole entire herbal farm was created for Brian. So that's the other connection there as well. So yeah. So listen, let me say a huge thank you from the bottom of my heart to both of you, Pooja and Vikram, for joining us, and many, many blessings and big hugs to Akash. May he continue on his journey of health and wellness.
Thank you, doctor.
Thank you very much, doctor.
That brings us to the conclusion of today's podcast. I hope Pooja's story was helpful and inspirational to many of you who are watching today. Thank you so very much for joining us for this podcast, and I look forward to seeing you at the next podcast. Namaste.
Thank you for joining Master Herbalist Dr. Jodi A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.